Bismillahirrahmanirrahim. Today we are going to make a video on the base of the skull, also called as Norma Basalis. So whenever we view the skull from the base, the view is called as Norma Basalis. Now the Norma Basalis, for convenience, is divided into three parts: the anterior half, anterior part, the middle part, and the posterior part. The anterior part originates or starts from the incisive teeth, the middle incisive teeth, and extends till the posterior nasal spine. This is the posterior nasal spine. Then the middle part begins from the posterior nasal spine till the anterior margin of the foramen magnum, and the posterior part from the anterior margin of the foramen magnum to the superior nuchal line. This is the superior nuchal line. Now the bones which can be seen in the Norma Basalis are this bone. This is the maxillary bone, and these are the palatine processes of the maxillary bone. So this one is the maxillary bone. Now this suture is visible. This suture demarcates the boundary between the maxillary bone and the palatine bone. This one is the palatine bone. And then this bone here, this is actually the part of the sphenoid bone. Sphenoid bone has four parts: body, greater wing, lesser wing, sella turcica, and this is known as the pterygoid process of the sphenoid bone. So this is known as the pterygoid process of the sphenoid bone, and here the greater wing of the sphenoid bone is also visible. Now this bone, this is actually the zygomatic bone, and this arch which is made by the zygomatic bone and a part of the temporal bone, this arch is known as the zygomatic arch. So then we have this bone. This is the temporal bone, and it has two parts. This is the petrous part, and this is the mastoid part of the temporal bone. So we can say that the petromastoid part of the temporal bone also can be seen in the Norma Basalis. Above we have the squamous part of the temporal bone. Then this part, this is known as the occipital bone, and this small area, it have two parts. This small part, this is known as the body of the sphenoid bone, and this is known as the basilar part of the occipital bone. So the body, actually if we see it from the interior, this makes the sella turcica. So the body of the sphenoid bone, this anterior one, and this is known as the basilar part of the occipital bone. So the bones which can be seen in the basilar view or the Norma Basalis are: one is repeated, this is known as the maxillary bone, palatine bone, the pterygoid process of the sphenoid bone, greater wing of the sphenoid bone, the zygomatic arch which is made by the zygomatic bone, and the part of and the process of the temporal bone. Then this is the petromastoid part of the temporal bone, occipital bone, and there is a small bone, this is known as the vomer bone. So vomer bone too can be seen with in the view of the base of the skull, which is known as the Norma Basalis. Now toward the processes of each bone, the first bone, this one is known as the maxillary bone. So the maxillary bone, this is the palatine process of the maxillary bone, and this suture, this is known as the intermaxillary suture. This fossa, this foramen is known as, actually this is the fossa, and it is called as incisive fossa. The components of the structure which passes through these fossas and foraminas will be discussed in a separate video. This video will focus on the processes and the foraminas of the base of the skull. So the components will be discussed in another video. So the intermaxillary suture, the incisive fossa, and here we have the alveolar processes for the teeth. Okay, now this is the palatine bone. So the palatine bone too has an interpalatine suture, and this suture which is between the maxillary and the palatine bone, this is known as the palatomaxillary suture. This is the palatomaxillary suture, and the palatine bone actually is a one bone, but during development it ossifies at this line, therefore it is known as the interpalatine suture. Actually the palatine is one bone, it is not two bones. Then this plate of the palatine bone is known as the horizontal plate of the palatine bone, and here a small part of the palatine bone, this is actually known as the pyramidal process of the palatine bone. Now this structure, this is the posterior nasal spine, and this aperture is known as the posterior nasal aperture, as we have the anterior nasal aperture. This one is the anterior nasal aperture. This small projection is known as the anterior nasal spine, which is made by the maxillary bone. Similarly, we have a posterior nasal spine, but this time this is made by the palatine bone, which is important to remember that the posterior nasal spine is made from the palatine bone, while the anterior nasal spine is made of the maxillary bone. Now here we have two foraminas. This large one, this is known as the greater palatine foramina, and this is known as the lesser palatine foramina. And then coming to the pterygoid process of the sphenoid bone. So the pterygoid process is actually the main formation. Allah subhanahu wa ta'ala has made this for this fossa. This is known as the pterygoid fossa, and this pterygoid fossa is protected by two walls. This one is known as the medial wall of the pterygoid fossa, or this is known as the medial plate of the pterygoid process of the sphenoid bone, and this one is known as the lateral process. And this small bony projection, this one, this spiny projection, this is known as the hamless. If I rotate the skull, this one, this is known as the hamless of the pterygoid process of the sphenoid. This is the medial wall, lateral wall, and in between we have the pterygoid fossa. Then if we come posteriorly and superiorly, actually I have this skull and I hold it from the posterior view. If we look at a skull in the real time view, then this fossa which I am going to discuss, this is actually present superior to the pterygoid fossa. So posteriorly and superiorly to the pterygoid fossa we have another fossa here, and we have this fossa. This is known as the scaphoid fossa, the pterygoid fossa and the scaphoid fossa. And then we have here a small opening, this one. This is known as the opening for the pterygoid canal. The contents of the pterygoid fossa actually enters the pterygoid canal and then into the then it passes over the foramen lacera. Okay, so this one. So this was the pterygoid process of the sphenoid bone. Then this small part, this is actually a part of the temporal bone, and this actually if you view from this side, this is the temporal bone, and this small part, this is known as the infratemporal crest. And this infratemporal crest is actually important because it makes the wall of the medial wall of the temporalis fossa, temporal fossa. Okay, so this is the infratemporal crest, and it makes the medial wall of the temporal fossa. And this one, this makes the lateral. Actually the temporal fossa becomes split here. It have two walls. This is the medial wall and this is the lateral wall. The medial wall is made by the temporal crest, the infratemporal crest, and the lateral wall is made by the zygomatic arch. So this would be discussed in the temporal fossa in a separate video, but we should know about these structures. Then we have the petromastoid part of the temporal bone, which actually is included in the second part of the Norma Basalis. This is the vomer bone, and vomer bone makes the posterior nasal crest. As we had the posterior nasal spine, this is the posterior nasal crest, and this whole structure, this is known as the posterior nasal aperture. As we have in an interior view, this one is known as the anterior nasal aperture, and this one is known as the anterior nasal septum or the anterior nasal crest. Now we have some foraminas here. We discussed this one. This is the opening for the pterygoid canal, this is the scaphoid fossa, and this is the pterygoid fossa. Now this one, this is actually the foramen lacerum, which can be seen from the above view as well, from the Norma verticalis. And this one, this is known as the foramen ovale, this one is the foramen spinosum, and this one is the carotid canal. The carotid canal is present in the Norma Basalis, but this cannot be seen from the above of the skull or the cranial cavity, because this canal is for the internal carotid artery, and when it enters it, it travels inside the bone and comes out of the foramen lacerum into the cranial fossa, into the middle cranial fossa. Then this one, this is the foramen spinosum. This is for middle meningeal artery, but the contents would be discussed in a separate video. Let's focus on the processes and foraminas. Now this one, this small projection, if I rotate this one, this is known as the spine of the sphenoid bone. This is known as the spine. This is the demarcation of the ending of the sphenoid bone, and this is the temporosphenoid suture. This is between the petromastoid part of the temporal bone, and this one is the sphenoid, greater wing of the sphenoid. So this projection is actually of the sphenoid bone, and this one is known as the spine of the sphenoid bone. And behind, posterior to this, we have the petromastoid part of the temporal bone. This is the spine of the sphenoid bone. Then we have the styloid process, the mastoid process. This one is the mastoid process of the temporal bone. This is the styloid process of the temporal bone, mastoid process, styloid process, and in between this one, this is known as the stylomastoid process. So three processes, and this one, this is known as the mastoid foramina, and this posterior to this mastoid foramina, this mastoid fossa, we have the mastoid notch. This one, this is known as the mastoid notch, and we have here the external acoustic meatus, and this groove is for the occipital artery, the occipital artery. And this is the posterior condylar fossa, or called just condylar fossa or posterior condylar fossa. And then here we have a canal, this is known as the hypoglossal canal. The hypoglossal nerve actually arises from here. And this foramina, this is known as the jugular foramina. This is the jugular foramina. This is the hypoglossal canal. And this is the mastoid notch and the mastoid fossa. And this is the stylomastoid foramina. And this stylomastoid foramina is very important to remember, because the facial nerve exits the cranium from here, this stylomastoid foramina. And then we have this is the basilar part of the occipital bone. These are the condyles of the occipital bone, or condyles of the skull. And this small tubercle, this is known as the pharyngeal tubercle, or the occipital tubercle, because it lies in the occipital bone, and this is called the pharyngeal tubercle. Okay, now here we have this is the external occipital protuberance. These are the superior nuchal line, these are the inferior nuchal line. And this is the external occipital crest, tubercle and nuchal lines. So this was all about the Norma Basalis.